Welcome back. In today's session, we are going to discuss about the dengue fever. Dengue fever is a continuation to the chapter Epidemiology of Communicable Diseases. It comes under the arthropod bone infections. We will start the topic dengue fever, and then in the next chapter we will discuss about the malaria and so on. The objectives of today's session will be the introduction to dengue fever, okay, the introduction to dengue fever, and we will also discuss the dengue syndrome, and we'll see the problem statement, epidemiological determinants. The epidemiological determinants will include three things, okay. The three things under the epidemiological determinants will include the agent factor. We have the agent factor, host factor, and also third one will be the environmental factors, okay, environmental factors. Then we will discuss the pathogenesis, clinical manifestations. Clinical manifestations are nothing but the signs and symptoms, Then we will discuss about the complications of dengue fever, the diagnosis, and followed by its management, okay. Now, let's move further to the introduction to dengue fever. So, we'll see that the dengue fever are caused by the dengue viruses. The dengue viruses are nothing but the arbovirus. They are the arboviruses which are capable of infecting humans and they cause the disease. You can see this dengue, this mosquito is having the dengue virus, and this dengue virus is a arbovirus. It is a arbovirus. It is capable of infecting humans. And it is causing the disease. Dengue fever is a self-limiting disease, which means that most of the times the dengue fever is a self-limiting disease. It resolves on its own without much medical intervention, okay, resolves on its own, is a self-limiting disease. So now we'll see in the next thing, that is the next heading is the problem statement. The problem statement is it is found in the tropical areas and subtropical regions all around the world. You can see the dengue fever is seen in the tropical areas. It is seen in the tropical areas and also the subtropical areas. In the problem statement, what you're going to write, it is found in the tropical areas and also the subtropical areas. Predominantly, most commonly, it is seen in cases of the urban areas and semi-urban areas. Tropical, subtropical, it is found in urban areas and also the semi-urban areas, and it is now spreading to the rural areas. About 3.9 billion people in 128 countries are at a risk. You can see that around 3.9 billion people in 128 countries. You can see around 3.9 billion people in 128 countries are at risk. A recent estimate showed that 390 million dengue infections are seen per year. How many people? The amount of people are 3.9 billion. Okay, the amount of people affected are 3.9 billion in the 128 countries, and a recent estimate is showing that 390 million dengue infections are seen per year. And you can see out of this 390 million dengue infections per year, only 96 million manifestations are clinically. With any severity of disease, only 96 millions will show up the severity of the disease. Okay, and then you can see the number of reported cases are increased from 2.2 million cases in 2010 to 3.2 million cases in 2015. Okay, year 2016 reported a large outbreak as well. Is it clear? The problem statement, we made it very simple. We'll just put it in a small box now First thing you're going to write, it is seen in tropical areas and also the subtropical areas. And then you will write it is seen in the urban areas and also the semi-urban areas. Now it is also seen in rural areas. Total 3.9 billion people are affected in 128 countries. 128 countries. And now the cases, a recent estimate showed that 390 million dengue infections are seen per year. Okay, per year 390. This is 3.9, and now per year 390 million cases are seen. And now the reports are increased from 2.2 million in 2010 to 3.2 million in 2015. In 2016 there was a large outbreak. Is it clear? Now we'll move further. In 2015, Delhi recorded its worst outbreak since 2006 with 15,000 cases. Okay, the worst outbreak was seen. The worst outbreak was seen in Delhi. It was seen in Delhi in the year 2015. The number of cases were 15,000. Okay. Dengue and dengue hemorrhagic fever in endemic in more than 100 countries in the World Health Organization regions of Africa, America, Eastern Mediterranean, Southeast Asia and Western Pacific. So you can see that the dengue fever, the dengue hemorrhagic fever is endemic. It is found to be endemic, which means that subtle number of cases are always found at certain period in almost every year. In 2015 the few cases will be there. In 2016 yes, 2017 yes. So almost all the years the cases will always be present every year in certain amount. Okay, so this is seen in more than 100 countries. So it has said to be endemic. It is endemic in more than 100 countries, especially in World Health Organization regions of Africa, okay, Africa, America, Eastern Mediterranean, Southeast Asia. In Eastern Mediterranean and Southeast Asia. Africa, America, Asia and Eastern Mediterranean. In India, the risk of dengue has shown an increase in the recent years. So, in the recent years, the risk of dengue has shown an increase. It is because of the rapid urbanization, the lifestyle changes, and the deficient water management. Okay. So, what did we understand in the problem statement? In India, what has happened? There is a recent increase in the cases. Why is there an increase in the cases? It is because of the rapid urbanization which is taking place, and you can see the improper water storage practices. The improper water storage practices will become a breeding ground for the mosquitoes. It will become a breeding ground for the mosquitoes, and the viruses will increase its production, and the mosquitoes will infect more and more number of people. So the improper water storage practices in urban areas, peri-urban areas, rural areas, etc. Dengue is endemic in 35 states in India. During the year 2017, about 1,57,996 cases were reported with 253 deaths. Even if you don't remember all of this information, simple things from the previous slide and from here you can remember that in 2015 the Delhi showed its world's worst outbreak, and then it is seen endemic in areas of, you can remember, Africa, America, Asia and Eastern Mediterranean. And then you will see that in the recent years you can write down that there is an increase in the dengue fever. Why is there an increase? You can easily explain improper water storage facilities, and water storage management is not proper because of the rapid urbanization, deficient water management, improper water storage, etc. Then you see in India, when you write about in India, you will also say that in 35 states it is said to be endemic. The case fatality rate is 0.16%. It shows that the fatality rate is 0.16. In the first slide only you saw that it is a self limiting disease, there is no much severity, but the case fatality rate is 0.16. All four serotypes of dengue, that is dengue virus 1, 2, 3 and 4, have been isolated in India, but at present dengue virus 1 and dengue virus 2 serotypes are mostly widespread. Is it clear? Very simple. What did we understand? That the dengue virus has four serotypes. What did we see? That the dengue virus has four serotypes. In the four serotypes, that is dengue virus 1, 2, 3 and 4, out of these the dengue virus 1 and 2 is most widespread. Is it clear? It is most widespread. Okay. Now we'll move further to the epidemiological determinants. Very important from your SPM point of view is the epidemiological determinant, the agent factor, host factor and environmental factor. Let us begin with the agent factor. In the agent factor, we'll see that the agent belongs to the genus Flavivirus. It is based on antigenic and biological characteristics. Okay, the agent factor, we see the dengue virus forms a distinct complex. It has a very its own characters are seen, its own characteristic complex within the genus Flavivirus. It belongs to the genus Flavivirus. Just like how we say the family's differentiation is made, right? Similarly, the dengue virus also belongs to the genus Flavi. It belongs to the genus Flavivirus. It belongs to the genus Flavivirus. How is it differentiated or characterized? It is based on its antigenic and biological characteristics. Okay, it has its own distinct antigenic and biological characteristics. There are four serotypes of dengue virus. We know the four serotypes are dengue virus 1, dengue virus 2, dengue virus 3 and dengue virus 4. These are the four serotypes. Very important. In the agent factor, you will write it belongs to the genus Flavivirus. It is based upon its antigenic and biological characteristics. It has four serotypes 1, 2, 3 and 4. The infection with any one serotype will give a lifelong immunity to that virus serotype. So now let me explain you this. For example, let us assume a person A is affected with dengue virus 1. So he gets a lifelong immunity against that virus. Next time if that virus A, if the first virus 1, dengue virus 1 tries to affect this person, he no longer will be affected by that. Okay. I don't know. Oh, sorry. Yeah. So we were discussing that the infection with one serotype will give a lifelong immunity against that virus serotype. It is postulated that virus antibodies are formed within few days of the second dengue infection, and that the non-neutralizing enhancing antibodies are promoting the infection of higher number of mononuclear cells, followed by the release of cytokines, vasoactive mediators and procoagulants. So to understand this paragraph, I will go in detail about it. Okay, and then when we come back and read this paragraph, you will get a better idea. So let me explain it to you. So what happens, basically you have to first understand that how the dengue virus affects the body, and it forms its own serotype causing the infection. So we see the first dengue infection. Let us assume the first dengue infection, the first serotype. Now there will be a first serotype. We have dengue let us assume dengue 1 or 2 or 3 or 4, what happens whenever the dengue virus, either of it is affecting the body will start to form antibodies. Okay, antibodies are formed against that particular serotype. Now let's assume dengue virus 1. So the antibodies are formed against the dengue virus 1 serotype. Okay, 1 serotype. Now these antibodies are providing the protection against only dengue virus 1. They won't provide protection against 2, 3 and 4. So next time what happens, second dengue infection happened to the person. Okay, now the second dengue infection. Now when the second dengue infection occurs, a different serotype is affecting the person. Let us assume dengue virus 3 is affecting the person. So the old antibodies, now this is a different serotype, right? Since this is a different serotype, the old antibodies, these old antibodies are now going to bind to this dengue virus 3, and they cannot kill this, they cannot neutralize this. Okay, they cannot neutralize this virus. They do not have the antibodies or the immunity against this dengue virus 3. Is it clear? So we understood that so far, that one serotype does not infer a immunity against a different serotype. Now let us see what happens. The antibody dependent enhancement occurs. So these new antibodies, so what is happening now, these new antibodies, what they'll do, these new antibody virus complex, this is a new virus, right? It has gone and bind to the previous antibodies. This new antibody virus complex will go and attach to the FC receptors. They will go and attach to the FC receptors which are present on, these FC receptors are present on, the FC receptors present on the monocytes, and these FC receptors are also found on the macrophages, monocytes and macrophages. This new virus antibody complex will go and bind to the FC receptors which are present in the monocytes, macrophages. Instead of blocking, these antibodies are indirectly helping the virus to enter the immune system. And now this entire virus antibody complex is taken inside the cell. Dengue virus will survive inside the cell and starts multiplying inside these immune cells. Okay. So what happens? This antibody virus complex has taken the virus inside the immune cells. Okay. It has taken the virus inside the immune cells. And now what happens? This virus starts multiplying. So the virus starts multiplying inside the immune cells. More and more viruses will multiply and they will affect the immune cells. Okay, the immune cells, the macrophages, monocytes are the immune cells, right? They are getting affected now, and the viral load becomes very high. The viral load is very high, and the body has started to release, because the viral load is high, the body now has started to release what? The viral load is high, the body has started to release cytokines. Okay. Oh, what is wrong? Yeah. The body has started to release the cytokines. Yeah. The body has started to release the cytokines, and then what happens? These cytokines, they will start to believe that there are so much high viral load and there is a severe attack by the dengue's viruses. So these cytokines will act on the blood vessels, they will start damaging the endothelial system, and they will cause this various signs and symptoms, okay, which we will discuss further. So you understood that, right? It is postulated that the virus antibodies are formed within a few days of the second dengue infection. We saw that the second dengue infection has occurred and the antibodies have formed against the second dengue infection, and the non-neutralizing enhancing antibodies, now they are promoting higher number of mononuclear cells, followed by the release of cytokines, the vasoactive mediators. They are also releasing cytokines, vasoactive mediators, procoagulants, and this is leading to disseminated intravascular coagulation. This I will discuss further. Is it clear? Now let's see what happens. The vector Aedes aegypti and Aedes albopictus, they are the ones who carry the high vectorial competency for dengue virus. So this Aedes aegypti mosquito and Aedes albopictus mosquito. Aedes is easy to remember, right? Aedes. And then we know mosquito. What are the two words you have to remember? Egypti. Okay? Egypti and albopictus. Is it clear? Aedes aegypti and albopictus. They both carry a high vectorial competency for dengue virus. That is, they have high susceptibility to infecting virus. They have the ability to replicate the virus and they have the ability to transmit the virus. What are the three abilities they have? They have a high susceptibility to dengue virus. They have high susceptibility to infecting virus. They are very much susceptible to dengue virus. Second, they have the ability to replicate the virus. And they have the ability to transmit the virus to another host, which is nothing but the humans. Is it clear? So the agent factor, we discussed about it. Now the vector, what is the vector here? Aedes aegypti mosquito and Aedes albopictus mosquito. And this albopictus and Aedes aegypti and Aedes albopictus, they have a high vectorial competency for dengue virus, which means they have high susceptibility, they replicate, ability to replicate is high, and their ability to transmit the virus to the another host is also high. Is it clear? Now we'll move further to the transmission of disease. The Aedes aegypti mosquito, now we'll see the transmission of the disease. The Aedes aegypti mosquito becomes infective by feeding on a patient from day before onset to the 5th day, that is the viremia stage of the illness. Is it clear? So what they are saying is, this mosquito becomes infective by feeding on a patient. You can see the Aedes aegypti mosquito is becoming infective by feeding on a patient when she is in the viremia stage of the illness. Viremia is what? When the dengue virus is circulating in the blood. This is known as viremia stage. What is viremia? Viremia is the dengue virus is circulating in the blood. When does the viremia stage occur? It is day before onset to 5th day. A day before onset to 5th day of the illness. Is it clear? A day before onset to the 5th day is that is the viremia stage of the illness. After an extrinsic incubation period of 8 to 10 days, the mosquito will become infective. So it takes almost 8 days to 10 days. Then what happens? The mosquito will become infective and is able to transmit the infection. Once the mosquito has become infective, it remains infective for its entire life. Is it clear? So, what happens a day before illness to the fifth day of the illness? During this period, the patients will become very much infective. When the Aedes mosquito will bite during this period, the mosquito will suck the blood which is containing the dengue virus, and this virus will go and enter into the mosquito's gut. The mosquitoes will become infective, but not immediately. Now, the virus will start multiplying inside the mosquito. From the gut, it will go into the salivary glands, which is nothing but the extrinsic incubation period. And then, when the mosquito infects the other person, that is how the mosquito will bite the another person. The virus from the infected saliva of that mosquito will go into the new human and infect them. I'll just show you in the picture, you will understand better. Okay, so what happens? We know so far that during the viremia stage of illness, the dengue virus is getting injected into the mosquitoes. What happens? You see here what they have written. The Aedes mosquito becomes infective by feeding. Okay, this Aedes mosquito, okay, this Aedes mosquito is getting infected. He is getting infected by feeding on a patient during the viremia stage. So what happens during the viremia stage? When does this viremia stage occur? A day before onset, to the fifth day of the illness. During this period, the patient becomes very much infective. How? When the mosquito, this mosquito will go and bite. This mosquito is biting on the person. It is sucking the blood out of it. It is sucking the blood, and this blood contains lots of dengue virus, because the dengue virus is circulating in the blood, and this virus will enter into the gut. Okay, let us assume this is a gut of the mosquito. It is entering the gut of the mosquito, and after entering the gut of the mosquito, the mosquito will become infective, but not immediately. It takes some time. In the gut, the virus will start multiplying inside the gut of the mosquito, and from the gut it will go and enter into the mouth of the mosquito. And when the mosquito will bite another person, he gets infected. Is it clear? So you can see here, how is the dengue transmitted by mosquitoes? The female Aedes mosquito will bite a person who's carrying the dengue virus during the viremia stage, which starts a day before the onset to the fifth day of the illness. And during this stage, the patient is becoming very infective, because the dengue virus in high load is circulating in its blood. And after biting this person, the infectious mosquito, the dengue virus will enter into the gut of the mosquito. So much multiplication takes place of the dengue virus. Okay, so the dengue virus multiplies inside the gut of the mosquitoes. From there it enters into the salivary glands, and from the salivary glands, when the Aedes aegypti mosquito will bite other patients, or sorry, the other healthy persons, then they become patients, which is nothing but they are affected with dengue virus infection. So the genital tract of the mosquito gets infected, and the trans-ovarian transmission of the dengue virus occurs. Can you just believe it, that the virus not just enters into the mosquito's salivary glands, but it will remain infective throughout its life? How? The mosquito, the virus will not just stay in the salivary glands, it will spread to the other organs. Okay, from it just not stays in the salivary glands, it spread to other organs. That is the ovaries, trans ovarian part, that is the ovaries. It spread to the genital tract. Trans ovarian transmission occurs from the mother, it enters into the eggs. Okay, from the mother it enters into the eggs, and when the eggs will hatch out, the mosquitoes are already infected with dengue virus. Is it clear? Next, we will move further to the environmental factors. The population of Aedes aegypti fluctuates with rainfall and water storage. Is it clear? The population of Aedes aegypti, how does it fluctuate? How is the environmental factors contributing? It is influenced by the rainfall. Okay, it keeps fluctuating with rainfall, and it fluctuates with okay, it fluctuates with rainfall and water storage. Its lifespan is influenced by the temperature 16 degrees Celsius to 30 degrees Celsius and a relative humidity of 60 to 80%. So you can see that the environmental factors is it is greatly influencing the temperature, the humidity. All this is affecting the lifespan of the mosquito. It will survive best. Okay, the best optimum or the best or the optimum temperature ranges from 16 degrees Celsius to 30 degrees Celsius, and the humidity is 60 to 80%. It breeds in the containers in and around the houses. What does this mosquito do? It will breed in the containers. It will breed in and around the houses in containers, and you can see that being a domestic breeder, it will breed very easily in and around the houses. Even with a 2-degree increase in the temperature, the extrinsic incubation period will be shortened, and the more infected mosquitoes are available for a longer duration. So besides that, the mosquitoes will bite more frequently because of the dehydration, and thus there will be an increase in the man mosquito contact. Can you believe how the temperature is affecting an increase? That the mosquitoes will undergo dehydration in summer when the temperature optimum was 16 to 30 degrees Celsius. If the temperature is increased by 2 degrees Celsius, what happens? Because of the too much heat increase in the temperature, the incubation period of dengue virus will be shortened and more infected mosquitoes will be available. Besides that, what happens? The mosquitoes are biting more frequently because of the dehydration. They want lots of blood to hydrate themselves, so they start biting more frequently, and there is an increase in the spread of man mosquitoes contact. Then you can see the failure in the urban authorities to provide the the civil amenities and the poor public health infrastructure. All of this also will raise the potential for the vector to breed at a higher level. You can see that there is a decrease in the amenities which are provided to the poor people. Okay, there is a decrease in the facilities or amenities which are provided to the poor public. There is a poor infrastructure, the poor infrastructure. So all of this is making the environment transmission more conductive. The rural spread of the vector is relatively recent occurrence associated with the development of rural water supply schemes. Okay, the improved transport system and the scarcity of water, the lifestyle changes, the urbanization which is also occurring in the rural areas, they are also contributing to the increase or enhancement in the transmission of dengue virus. And you can see the incubation period is 3 days to 10 days. Now we will move further to the high risk patients. The high risk patients are the infants and elderly. So what happens in the infants and elderly? There is a weak immune system. In infants and elderly, there will be a weak immune system, and as I explained you earlier, that when the mosquito bites the another person, the virus which is infected with saliva is entering into the new human person. He gets infected, and then what happens? You know, right? What happens in the body when the virus enters into the new person? Okay, when the virus enters into the new person, the virus will start multiplying in the immune cells. They will start multiplying in the immune cells, that is the monocytes, macrophages. And then what happens, because of this, the body feels there is a high attack. There is a release of cytokines, vasoactive agents, and all of this is causing a damage to the blood vessels. They are causing a damage to blood vessels. There is a leak, okay, there is a leak of the there is a plasma leakage out from the blood vessels, the plasma leak. So once the plasma is leaked out, the blood becomes more concentrated, so there will be low BP, and the patient can also end up in shock. Is it clear? So, keeping that in the background, let us see who are the high risk patients. We know how the pathophysiology behind the dengue virus infection. Now, let's see who are the high risk patients. Let us begin with infants and elderly. The infants and the young children, elderly patients, they will have a weakened immune system. There will be rapid fluid shift, so there will be higher risk of shock in these patients. Weak immune system, rapid shift, rapid fluid shift. Then we'll see in obese patients, in pregnant women. So here the patients in elderly and obese patients, they will have multiple comorbidities present in them. The comorbidities multiple comorbidities like diabetes, hypertension, thyroid, etc. And they will have an increased risk of bleeding, organ failure, shock, etc. Okay, they will also have an increased risk of bleeding, organ failure, and they'll have an increased risk of shock. And even in pregnancies, the plasma volume has a physiological changes, right? Yeah. In pregnancy, the plasma changes will be there. The plasma volume changes will be more. Physiological it is, okay? Physiological changes will be more. Naturally, 40 to 50% increase will be there in the fluid shift. You know, lots of edema will be seen in cases of pregnant women having swelling in their feet, edema of the feet. And then the fluid shift increases in cases of dengue. When the fluid shift increases, there will be decrease in the blood pressure, the patient can go into shock, then organ damage can also be seen. Next we will see the peptic ulcer diseases. In peptic ulcer diseases, there is also again an increased risk. Women who are in menstruation or having an abnormal bleeding, okay. And then we have hemolytic diseases like G6PD, thalassemia, and other hemoglobinopathies, because there is again coagulation problems. Then we have congenital heart diseases. We have chronic diseases like diabetes mellitus, hypertension, asthma, ischemic heart diseases, chronic renal failure, liver cirrhosis. Those patients with all these diseases, like the congenital heart diseases, those who are having diabetes, hypertension, asthma, ischemic heart diseases, IHD, ischemic heart diseases, chronic renal failure, CKD patients, end stage renal disease patients, renal failure patients, and then liver cirrhotic patients, and those patients on steroids, NSAIDs treatment, they are at a higher risk. Okay, so you know, what happens when the platelet activation and clearance is seen, the virus will activate the platelets. They make them more to stick together. The platelet will stick together. More of clumping will be there. Is it clear? Now, when I explain you further, you will understand this in detail. Now, we'll see about the manifestations of dengue virus infection. The dengue virus infection will manifest itself as a asymptomatic infection, and then it will also be seen and as a symptomatic infection. There will be asymptomatic presentation or a symptomatic presentation. The asymptomatic presentation does not have any signs and symptoms. It is just one heading: dengue virus infection divided into asymptomatic and symptomatic. Now let us discuss symptomatic in detail. The symptomatic presentation can be an undifferentiated fever like a viral fever, viral syndrome, or it can be differentiated into dengue fever. The dengue fever can occur without any hemorrhage or with an unusual hemorrhage. Is it clear? We'll also write down here: dengue fever can be divided into asymptomatic or symptomatic. In the symptomatic, again, it can be divided into 1, 2, 3 headings. Okay, in the 3 headings, we have the first one: undifferentiated fever, undifferentiated fever, or we have the dengue fever. Differentiated dengue fever, undifferentiated fever, and dengue fever. Dengue fever can be without hemorrhage, or it can be with hemorrhage. Is it clear? Asymptomatic, symptomatic. In symptomatic, undifferentiated fever, differentiated fever. In differentiated fever, that is dengue fever. The fever was undifferentiated. Here you recognized it to be a dengue fever. The dengue fever can be without hemorrhage, or which it can be with unusual hemorrhages. Now the second division will be dengue hemorrhagic fever. Along with the plasma leakage, dengue hemorrhagic fever. The dengue hemorrhagic fever can be non-shock. Okay, you're dividing it into non-shock or with shock. Non-shock or with shock. It is known as dengue hemorrhagic fever with shock is known as dengue shock syndrome. Dengue shock syndrome. Then the last differentiation will be expanded dengue syndrome with isolated organopathy, which is an unusual manifestation. We'll see that it is an expanded dengue syndrome. Is it clear? Do you want me to write it down again? You will have a perfectly, you will be able to remember it now. How do we differentiate this? Very important in your medicine subject also. They will ask you about this. The manifestation of dengue virus infection. How does dengue virus manifestation occurs? It can be divided into 2: asymptomatic, simple, or it can be symptomatic. Symptomatic is divided into 3. The last one you can first write it down. It is expanded dengue syndrome. Expanded dengue syndrome. The expanded dengue syndrome. Next we have the 2 things. This is very easy: undifferentiated fever, or we have dengue fever. The dengue fever can be without hemorrhage, or it can be with hemorrhage. Then next we have dengue hemorrhagic fever. In the dengue hemorrhagic fever, it can be non-shock dengue hemorrhagic fever or dengue shock syndrome with shock. Okay, very simple: non-shock with shock. If it is with shock, dengue shock syndrome. Is it simple and clear? Now let's see the next, the pathogenesis. From the previous slides, you might be much aware about the pathogenesis. So we will quickly try to understand how it happens. First, I will explain you this. Then we will go into the paragraphs what is written. So the bite of the Aedes aegypti mosquito. The virus is entering into the skin. Now let us assume this is the person. The bite of the Aedes aegypti mosquito. The virus has entered into the skin. The virus will infect and replicate inside the Langerhans cells, the immunity of the skin. So you can see that the virus is affecting the Langerhans cells. Now what's happening? The Langerhans cells will release the interferons to limit the spread of the infection. So they are infecting and replicating inside the Langerhans cells, and now these Langerhans cells are releasing the interferons to limit the spread of the infection. the infected Langerhans cells will go to the lymphatic system to make the immune system alert. Now, whatever the infected Langerhans cells are there, they will go to the lymphatic system. They will enter into the lymphatic system to alert that there is some virus or the pathogen from outside. Then it enters into the circulation, which is resulting in the viremia. The virus is entering into the blood, resulting in viremia. High levels of virus is seen in the bloodstream. Then the activation of immune response occurs. There is an increase in the lymphocyte release, the decrease in neutrophils and white blood cells. The release of pyrogen is causing fever, increase in blood pressure in the vessels, and they are causing the rashes and dengue. So we'll see how it occurs. The dengue virus will infect the Langerhans cells. Virus will replicate in these cells. These cells, what happens normally, I will just first explain you the normal thing and then you'll be able to understand. Yeah. What happens? The Langerhans cells. These Langerhans cells normally protect us. What is the function of these cells? They normally protect us from the outside pathogens. It can be foreign body, virus, bacteria, virus infection, bacterial infection, fungus, whatever. So normally the Langerhans cells protect us, but dengue instead uses this Langerhans cells to spread the infection. How? These Langerhans cells are going to the lymph node, and from the lymphatic system these are entering into the bloodstream, and from this blood, once the virus is entering into the blood, it leads to fever, increased body pain. So, the activation of this immune system is leading to this enter into the lymphatic system, into the blood, and once this happens, there is an activation of immune system. So, the immune system gets activated. The immune system's activation is leading to the increase in the lymphocyte count. Okay, there will be an increase in the lymphocyte count. The cytokines will get released. The cytokines, we have interleukin 1, interleukin 6, tumor necrosis factor alpha, and along with this there is a decrease in the neutrophil count and total WBC count. The dengue is causing the bone marrow suppression, so this will lead to a decrease in neutrophil count, which is nothing but neutropenia and leukopenia. The cytokine release will cause high fever, affecting the blood vessels, causing the capillary permeability, increases the capillary permeability, and endothelial dysfunction occurs, plasma leak occurs, and the patient will have rashes. Is it clear? I hope you've understood this. From here, when we go through again, now after explaining you the background, you might understand much better. The bite of Aedes aegypti mosquito, the virus is penetrating into the skin. So the Langerhans cells were supposed to protect us. Now the virus has done what? It is using this Langerhans cells is to enter into the bloodstream. How? The virus has started to infect them and started to replicate inside the Langerhans cells. The Langerhans cells are releasing the interferons to limit the spread of infection, and the infected Langerhans cells are reaching out to the lymphatic system to make the immune system alert, and from the lymphatic system it enters into the circulation, and once the virus is entered into the blood, it is known as viremia, and the high level of virus is seen in the bloodstream, and all of this is activating the immune response. There is an increase in the lymphocyte count. And how does the neutrophils and WBCs decrease? It is because this virus, it also enters into the bone marrow. It causes its suppression. The suppression of the bone marrow decreases in the production of neutrophils and white blood cells, and in the bloodstream it also releases pyrogens. These pyrogens will cause fever and increase in the blood pressure in the vessels, and then there is a plasma leakage out from the blood vessels, and once the plasma leaks out, there will be rashes, dengue fever, shock, etc. So now let us see what's written in the paragraphs. It is characterized by plasma leakage, hemoconcentration, bleeding, and organ impairment. Now let us understand this. So far, I hope it is very clear to you guys and you don't have any doubts. In case there is any doubt coming up, you can clearly put it down in the comment section. I will try to solve your doubts as possible. So we'll see that it is causing the plasma leakage. You know that uh, this dengue virus is causing a break in the epithelial lining. The break in the epithelial cells will lead to the plasma to be leaked out from the blood vessels into the interstitium. Okay, from the blood vessel it enters into the interstitium. It leads to the plasma leakage. And then it is causing the hemoconcentration. Obviously, if the plasma is leaked out, plasma leakage, the plasma leakage causes a increased concentration of the blood, then it can result in bleeding and organ impairment. So what happens? The dengue virus is causing the thrombocytopenia. It affects the bone marrow, right? So it is also causing the decrease in the platelet count. The platelet dysfunction is leading to the disseminated intravascular coagulation. So the decreased platelet count and the immune suppression, the bone marrow suppression is causing a decreased platelet production. The virus is attaching to the platelet themselves and it also causes the destruction, and this all of the destruction will produce in the bleeding and organ impairments. And then we'll see the plasma leakage. How the cause of the plasma leakage is probably because of the functional endothelial cell dysfunction or activation. The endothelial cell dysfunction is resulting in the mediated, in turn is mediated by the activation of infected monocytes, T cells, complement system mediators, monokines, cytokines, and soluble receptors. You know very well, we have studied about it in detail, that what happens, these Langerhans cells enters into the blood, and once it enters into the bloodstream, what it does, it goes and affects the immune cells. The immune cells are nothing but the monocytes and macrophages, and activation of these immune cells or the endothelial cells, they get activated, and then the dysfunction occurs, and they are resulting in the release of cytokines. The complement system, that is the cytokines, get released. The cytokines will include interleukin 1, interleukin 6, and tumor necrosis factor alpha. So all of these mediators, the monokines, cytokines, soluble receptors are activated, and all of this is causing the damage of endothelial cells and leading to the plasma leakage. And now we'll see about the bleeding. The bleeding may be due to thrombocytopenia. As I told you, thrombocytopenia occurs. Thrombocytopenia is nothing but the platelet dysfunction is seen, and then leading to the disseminated intravascular coagulation. And then how the dengue virus causes this? There is a decrease in the platelets production. There will be decrease in the platelet production. There is decrease in the platelet production because of the suppression of the bone marrow suppression, and the virus also attached to the platelet itself, causing its destruction. Immune mediated destruction will occur. Then these antibodies production against the virus, so these antibodies also will react with the platelet surface proteins, and these antibodies will tag the platelets for destruction. Is it clear? You understood what happens? These antibodies, they will start when the antibodies are produced against the virus. These antibodies will previous antibodies, they will go and tag themselves along the platelets and causing its destruction. I hope all of this is clear. Then we'll move further. What happens? These activated platelets will quickly, how the organ impairment occurs, we'll see. The thrombocytopenia may be due to increased destruction or the consumption, and these activated platelets are removed more quickly from the circulation by spleen or the liver, and the cytokines will cause the platelet destruction. They will cause the capillary leak, worsening the bleeding risk. Is it clear? Now we'll see the clinical manifestations. Infants, children, adults who have been infected for the first time will develop the simple fever with other viral infection, and then they will have the maculopapular rashes along with the fever. How the fever is seen in cases of dengue? What happens? The cytokines being released, and the pyrogens. We have cytokines like interleukin 1, tumor necrosis factor alpha. They are released during the viremia stage. When the virus enters into the blood, during the viremia stage, there is a cytokine release and pyrogen release, and all of this is leading to severe headache. Okay, and we can see the viremia occurring. Upper respiratory system infection, upper respiratory symptoms are seen. Gastrointestinal symptoms are common. Next, classical dengue fever. All the ages and both the sexes are susceptible. We see it affects all ages, that is the children, the middle aged people, elderly people, older elderly people, middle aged young persons, everyone are affected, and both the sexes, that is male and female, are susceptible. The onset of dengue fever is sudden. The patient can present with chills and high fever, intense headache. We know that the cytokine release, the intense headache is seen because of the cytokine release, and the intense headache, the cytokine release and the pyrogen release will lead to the viremia, and then the pyrogen release. All of this is leading to intense headache, muscle and joint pain, which prevent all the movements. Okay, the severe headache is seen. The intense headache, mostly the frontal headache, it is because of the meningeal irritation, because of the cytokines in the blood. They are causing the meningeal irritation. Trigeminal nerve stimulation, and this inflammation will stimulate these nerves, resulting in the headache. Is it clear? And then patient also presents with retroorbital pain within 24 hours. Retroorbital pain, what is retroorbital pain? It is a cytokine mediated inflammation and edema of the orbital soft tissue. You can see in the eyes here, orbital pain will be there. Okay, the orbital pain, there is a inflammation and edema of the orbital soft tissues, and then inflammation of ophthalmic division of the trigeminal nerve. I told you that the trigeminal nerve inflammation and irritation will be there, and this is causing the irritation of this trigeminal nerve, and this trigeminal nerve have its ophthalmic division, right? So that leads to the orbital pain. That is the deep pain behind the eyes what the patient complains of. And there is a pain particularly on eye movement, on eye pressure, and photophobia develops. Other common symptoms will include anorexia, extreme weakness, constipation, altered taste sensation, colicky pain, abdominal tenderness, dragging pain in inguinal region, sore throat, general depression, etc. And then the fever is usually between 39 to 40 degrees Celsius. It will last about 5 days, and it is rarely more than 7 days. It is rarely seen more than 7 days. It lasts for about 5 days. Okay, fever is mostly up to for 5 days. The temperature is 39 degrees Celsius to 40 degrees Celsius. Okay, the other symptoms, we have rapid pulse, vomiting. Vomiting is seen when the cytokines will go and stimulate the ctz area. Okay, And then once the CTZ area is stimulated, the gastric mucosal inflammation is seen, and that is leading to abdominal pain, colicky pain. The mucosa of the gastric system is also irritated, and constipation can be seen because there is a plasma leakage, complete dehydration. The abdominal tenderness is seen, dragging pain in inguinal area, etc. Next, we will move further to the dengue hemorrhagic fever. Dengue hemorrhagic fever is a severe form of dengue fever. The course of dengue illness can be divided into three phases, which is the febrile phase, critical phase, recovery phase. Is it clear? The dengue hemorrhagic fever is characterized into three phases. The three phases will include, what are the three phases? We have febrile phase, critical phase, and recovery phase. Okay, let's see about the febrile phase. Following an incubation period of 4 to 6 days, the illness begins with, okay, following a phase of incubation period will be 4 to 6 days. Once the Aedes aegypti mosquito bites a person, following 4 to 6 days of incubation period, what happens? The person will begin to show symptoms of abrupt high fever from 39 to 40 to 41 degrees Celsius. It is associated with facial flushing. It is associated with facial flushing and headache. The patient will also have anorexia. Anorexia is nothing but the loss of appetite. There is loss of appetite, vomiting, epigastric discomfort, tenderness at the right costal margin, generalized abdominal pain. These are the common manifestations. Is it clear? What are those? The patient will start with anorexia, loss of appetite, vomiting, epigastric discomfort. Okay. In the febrile phase, we saw fever. Then you will mention about the gastric symptoms. In the gastric symptoms, you will start with anorexia, okay, loss of appetite, anorexia. Then the patient will have lots of vomiting, anorexia, vomiting, and then we have epigastric discomfort. In the stomach, you can mention about the epigastric discomfort, the epigastric discomfort, anorexia, vomiting, epigastric discomfort, abdominal pain. These are the common symptoms. Febrile convulsions may occur in cases of infants. Laboratory findings will show moderate to marked thrombocytopenia, which is a decrease in the platelet count, because all the fluid has got plasma leakage has occurred. The blood has become more concentrated. The platelets have got stick together, and the virus is the virus is going and combining with the previous antibodies and making the platelets more susceptible for destruction, and the virus is destroying the platelet by itself. Then the virus is going and suppressing the bone marrow, and the bone marrow suppression is leading to the decreased production. And once the platelets are altered, the liver and spleen are destroying the platelets, removing from the body. So all of this is leading to thrombocytopenia, and there is a raising hematocrit value. Okay, and there is a rise in the hematocrit value. Is it clear? The febrile phase. Now we will move further to the febrile phase is done. We saw in the febrile phase there was fever, GI symptoms, and then along with the fever and GI symptoms, what did we see? The patient in the GI symptoms will have anorexia, vomiting, epigastric discomfort, tenderness in the right costal margin, abdominal pain, and along with the fever we have facial flushing was there, and the patient had headache. Is it clear? And then we saw that the temperature was very high fever, 40 to 41 degrees Celsius. Then what is the main pathophysiological changes which will determine the severity of the disease? That we saw the rise in the hematocrit value. Okay, the rise in the hematocrit value, and we also saw there is thrombocytopenia. Then you will mention about thrombocytopenia. These are the lab changes. Lab changes, thrombocytopenia, and increase in hematocrit value. Is it clear? I hope you'll remember it very nicely. Now we will see what is the critical phase. In the critical phase, around the time of defervescence, we see that when the temperature is dropping to 37.5 degrees Celsius to 38 degrees Celsius or less than that, or it is remaining below the normal level, usually this is seen from the day 3 to day 7 of an illness. It is because there is an increase in the capillary permeability in parallel with the increasing hematocrit levels may also occur. So you can see that there is an increase in the capillary permeability and there is an increase in the hematocrit levels. Progressively, the patient also presents with leukopenia, decrease in the WBCs, followed by a rapid decrease in the platelet count. Okay, there is leukopenia, decrease in the platelet count. Usually, it precedes the plasma leakage. At this point, what happens? Patients without an increase in capillary permeability will improve, while those who are having an increased capillary permeability will become more and more worse as a result of lots of plasma leakage. There is a loss of plasma volume. The degree of plasma leakage will keep varying. The pleural effusion mostly is seen on the right side, and ascites may be clinically detectable depending upon the degree of the plasma leakage and the volume of the fluid therapy. The gallbladder edema is also seen in cases of the plasma leakage, hence the chest x-ray, abdominal ultrasound, they can be useful diagnostic tools, and the degree of increase above the baseline hematocrit often reflects the amount of severity of the plasma leakage. And also in the critical phase, the shock also occurs when the critical volume of plasma is lost through the leakage. It is often preceded by warning signs of abdominal pain. Abdominal pain is nothing but it can also present with the abdominal tenderness. There will be persistent vomiting, clinical fluid accumulation, mucosal bleeding, lethargy, restlessness, liver enlargement more than 2 centimeter, and oliguria. The body temperature can also come to subnormal when the shock occurs. So with the prolonged shock, the consequent organ hypoperfusion is also seen. So the organ impairment, metabolic acidosis, disseminated intravascular coagulation occurs, and this in turn leads to severe hemorrhage, causing the hematocrit to decrease in cases of severe shock. Is it clear? In this, what are we remembering in the critical phase? In the critical phase, the temperature is dropping. The temperature drops from 37.5 to 38 degrees Celsius or less than that. And main important, there is an increased capillary permeability. Okay, there is an increased capillary permeability. What are you going to remember? There is increased capillary permeability. So the more capillary permeability occurs, the permeability, there is more capillary permeability, and this capillary permeability is leading to plasma leakage. So once the capillary permeability becoming more and more worse, the plasma leakage worsens, and this plasma leakage will affect in the lungs. In the lungs, it can result in pleural effusion. Okay, in the lungs, it can be seen in the form of pleural effusion. This can be detected by X-ray. And this plasma leakage in the abdomen, you can see in the form of lots of fluid accumulation, ascites. And this ascites, you can see the gallbladder can also be enlarged, gallbladder edema, GB edema can be seen. And to diagnose this, USG abdomen can be done, USG can be done. And then shock also occurs when the plasma leakage is too much beyond, beyond the normal levels. We can see the shock also occurring. The shock has previous warning signs. Okay, the shock has its important warning signs. The warning signs will include the abdominal pain and tenderness. Abdominal pain and tenderness. The shock will have, the patient will have a persistent vomiting. He can have persistent vomiting. Clinical fluid accumulation can be seen. The fluid accumulation can be seen. Restlessness, lethargy, the patient can become drowsy, and also liver enlargement, hepatomegaly can also be seen. Okay, now we'll see the patient can also have hepatomegaly. The dengue virus, what happens, how the hepatomegaly occurs. The dengue virus will infect the hepatocytes, and it also affects the hepatocytes, the Kupffer cells, and the liver becomes inflamed and enlarged. The inflammation occurs when the virus affects the hepatocytes and Kupffer cells. Inflammation occurs, enlargement occurs, and this inflammation and enlargement is leading to the stretching of the glissons capsule. So the pain sensitiveness occurs. The tenderness is also seen at the right costal margin. There is a tense, it stretches the glissons capsule, stretching of the glissons capsule, and this stretching is causing the tenderness at the right costal margin. Vomiting, abdominal pain, tenderness also suggests the plasma leakage. Now we'll see the dengue virus will also infect the heart muscles, conduction system, leading to myocarditis as well. Now we'll see the recovery phase. In the recovery phase, if the patient survives the 24 to 48 hours critical phase, now gradually what happens, the reabsorption of the extravascular compartment fluid takes place following the 48 to 72 hours. So if the patient survives the day 1, 2 and third day, from the third day onwards, the reabsorption of the in the extravascular compartment fluid occurs. The general well-being will improve. As the term recovery suggests, we have to write down the well-being of the patient improves, and appetite will return back. The GI symptoms will improve, they will come down a bit, and hemodynamic status will stabilize, and the diuresis ensues. So we see that in the recovery phase, the patient has started to improve its appetite, the hemodynamic status is stabilizing, and diuresis is ensues. Some patients may also have rash of isles of white in the sea of red. Some may experience generalized pruritus, the overall body there will be itching, and others will have this rashes, and the isles of white is seen in the sea of red. You can see the skin is referred to as sea of red, and the white rashes, white spots are the isles of white. The bradycardia and electrocardiographic changes are very common, and the hematocrit will stabilize or it can be lower because of the dilutional effect of the reabsorbed fluid. Suddenly, all the fluid from the extravascular compartment, is being reabsorbed again. Because of the dilutional effect, the hematocrit will either stabilize or it might also become lower because of the rapid reabsorption of the fluid from the extravascular compartment into the intravascular compartment, which is nothing but the blood vessels. The white blood cell count usually starts to rise, but the recovery of the platelet count is typically later than that of the WBC count. And when you see the blood reports, you can see the platelet count, you can compare from the previous, from the day 1, day 2, day 3, how the platelet count is coming back, but it is more late than compared to the WBC counts. The white blood cell count will start to rise, but the recovery of the platelet count is later than that of WBC count. During the critical and the recovery phases, the excessive fluid therapy is associated with pulmonary edema and congestive heart failure. Can you see that? During the critical phase or during the recovery phase, if there is excessive intravenous fluid administration, then this will lead to pulmonary edema. So the fluid monitoring is also very important, because during the recovery phase the fluid is already being absorbed from the extravascular compartment into the blood vessels. So the volume overload can occur, resulting in the congestive heart failure, and pulmonary edema is also seen. So what we have to do, during the recovery phase, it is better to stop the patient on IV fluids. In dengue fever, you can look into the treatment chart in the IPD patients, how, or in the OPD basis also. If you are treating this dengue patient, you can look into the treatment chart, how the IV fluid are being tapered, and during the recovery phases the IV fluids are stopped. Now we'll see the severe dengue. Severe dengue is defined by one or more of the following. What is severe dengue? Severe dengue is nothing but the plasma leakage that will lead to shock. That is dengue shock, or the fluid accumulation with or without the respiratory distress, or it can be presenting as a severe bleeding and severe organ impairment. Is it clear? 1. Severe dengue is defined by plasma leakage. The plasma leakage may lead to shock, or it may lead to fluid accumulation with or without the respiratory distress. It can lead to severe bleeding and severe organ impairment. As the dengue vascular permeability will progress, hypovolemia will worsen and result in shock. The vascular permeability will progress. There is a damage to the epithelial cells, so lots of plasma leakage occurs from the blood vessels into the interstitial compartment. All the fluid is getting leaked out. So there is a as the dengue vascular permeability is progressing, the hypovolemia, the volume, okay, hypovolemia will worsen and the patient will go in shock. During the initial stage of shock, the compensatory mechanism will try to maintain a normal systolic BP. It also produces tachycardia, and peripheral vasoconstriction will reduce with reduced skin perfusion, resulting in the cold extremities and delayed capillary refill time. Okay, let me explain this to you. You can see that as the dengue's vascular permeability is progressing and hypovolemia is worsening, it will lead to shock. So what happens, uh, during this initial stage, a compensatory mechanism starts. The body is trying to maintain the normal pumping blood pressure, normal systolic blood pressure, so that all the organs are getting enough blood supply. The compensatory mechanism is taking place. The heart is trying best to pump the blood pressure, so the normal systolic blood pressure is maintained. So as a result, since there is hypovolemia, now let us consider this is the heart should have proper volume, okay, so that it can pump the enough blood to all the organs. Since there is hypovolemia, the stroke volume is reduced, the blood supply will be compromised. So what happens, the heart is trying to have its compensatory mechanism, trying to beat faster and faster, harder, and it is resulting in tachycardia, So the patient presents with a compensatory mechanism, trying to maintain normal blood pressure. In order to maintain a normal blood pressure, the heart is trying to beat faster, producing tachycardia, and it also tries to constrict the blood vessels. One, it will produce tachycardia, beats faster, and then it also tries to constrict the blood vessels, causing the peripheral vasoconstriction and reduced skin perfusion. The blood supply to the skin is reduced, vasoconstriction occurs, and reduced skin perfusion, and the reduced skin perfusion is resulting in the cold extremities. Is it clear? The patient in dengue shock syndrome will remain conscious and lucid. Prolonged hypotensive shock and hypoxia will lead to multi organ failure. Is it clear? Now we'll see finally what happens. A prolonged hypotensive shock occurs, hypoxia. This is leading to multi organ failure and extremely difficult clinical course. Now we'll discuss the course of the disease. The course of dengue illness, you can see the temperature in the day 1. Now let's see up to 10 days they've given the phase here. In the day 1, the temperature, you can see it rises to 38, 39, 40, 41 degrees Celsius, and then it from on the day 3 onwards it drops down, comes down to the normal. And next you will see in the potential clinical issues. In the first, you can see the dehydration, then the shock can occur, there will be bleeding, organ impairment if the disease progresses on the day 4, 5, 6 onwards, and if the patient recovers, then there will be reabsorption and the fluid overload in the last few days. Next, we will see the laboratory changes. There is an increase in the hematocrit values, then there will be a decrease in the hematocrit value because the fluid has started to reabsorb back into the body, and the platelet count, which was reduced initially, has come back to the normal. And then we have serology and virology. In the first 3 days, we have viremia stage. The virus is circulating in the blood. And then what happens during the critical phase? There is a slight increase in the viremia. And then what happens? Then the patient in the recovery starts to develop the antibodies against this virus, producing IgG and IgM antibodies. Okay, this is a febrile phase. In the febrile phase, okay, in the febrile phase, you can see there is viremia, there is an increase in the hematocrit value, dehydration occurs, and the temperature increases. During the critical phase, there is a slight viremia and the laboratory changes. There is an increase in the laboratory. You can see the hematocrit value increases, and we have potential clinical issues like organ impairment, shock, bleeding occurs, and the platelet count decreases, WBC count decreases. There is a suppression of the bone marrows as well. And then you can see the temperature falls down, and in the reabsorption the temperature comes to normal. In the recovery phase, the patient will develop antibodies, platelet counts come to normal, the reabsorption occurs. If there is too much IV fluids given, the fluid overload can occur. Next, what is the criteria for the clinical diagnosis? If the patient presents in the dengue fever, he will have the acute febrile illness will contain one of the following. We know very well the patient will present with fever, headache, retroorbital pain, body pain, myalgia will be there, arthralgia, the muscle pain, bone pain, okay, muscle pain, myalgia, arthralgia or bone pain will be there. And then the patient will present with rashes, leukopenia, Okay. The patient can present with leukopenia, then because the virus is attacking the immune cells. The virus is going and attacking the immune cells, that is monocytes, macrophages. The virus is staying there and multiplying within the immune cells, so it is leading to the leukopenia, decrease in the WBC count. Then there is thrombocytopenia. Platelet count will be less than 1,50,000. So we know how the platelet count decreases. We saw the various mechanisms behind the destruction of the platelets. We saw that the dengue virus will first, it will multiply in these immune cells, and decrease in the immune cells occur. There is a release of cytokines which is producing all these signs and symptoms, and in the platelets what happens, the virus will itself go and attack the platelets, or it will activate the platelets. Okay, let us write down here. The virus uh, the virus is attacking the platelet cells. The virus attacking the platelet cells directly attacks the platelets, or it can activate platelet, make them stick to each other, activates platelets, makes the platelets stick to one another, make it more prone to clumping. Okay, activated platelets who are clumped together, they are removed by the liver and spleen. The liver and spleen will clear them out. Okay, and then the cytokines will cause the platelet destruction. The cytokines which are released are causing the platelet destruction. The cytokines are causing the platelets to be destructed. And you can also see that the immune system is producing the antibodies against this virus, and the antibodies are cross reacting with the surface proteins of the platelets, and they are tagging its destruction. And the platelets are also reduced production of platelets because of the suppression of bone marrow, suppression of megakaryocytes. There is suppression of bone marrow. Are you clear how the platelets are reduced? One, the cytokines are causing its destruction. Their platelets are getting activated, clumping occurs, abnormal platelets, so the liver are and spleen are filtering it out of the body, and then the decrease in the platelet count production because of the suppression of the bone marrow. I hope it is clear. And now let us move further. The leukopenia is seen, thrombocytopenia, platelet count decreases, and rising hematocrit. As I told you, the plasma leaking out, the blood becomes more concentrated, so the hematocrit values increase. Okay. Next, we will move further to the dengue hemorrhagic fever. The acute onset of fever to 2 to 7 days duration. In dengue hemorrhagic fever, there is an acute onset of fever. Hemorrhagic manifestations are seen. There is positive tourniquet test, and there is also petechiae. Is it clear? In the dengue hemorrhagic fever, there is a positive tourniquet test. Petechiae will be seen, ecchymosis, purpura, bleeding from mucosa, and then gastrointestinal symptoms. Injection, so the bleeding can occur from the injection site, bleeding can occur from the gastrointestinal tract, and various other locations. And the rising hematocrit value more than 20%, or hemo concentration is seen from more than 20% of baseline. Okay, from the baseline values there will be increase by 20. Or it shows the evidence of plasma leakage such as pleural effusion, ascites, hypoproteinemia, albuminemia, etc. And also we'll see that the platelet count is reduced by 1 lakh. Is it clear? In the dengue hemorrhagic fever, we have acute onset of fever. Okay, in the word hemorrhagic itself, you know that the patient will present with bleeding. The bleeding can occur in the dengue hemorrhagic fever there will be bleeding. In the bleeding it can occur from the mucosa, gastrointestinal tract, from the and the patient can also present with spots like petechiae, ecchymosis. The patient can present with ecchymosis, purpura, petechiae, positive tourniquet test. Is it clear? Now we'll move further. Okay, to the dengue shock syndrome. In the dengue shock syndrome, we have tachycardia, cold extremities. So the patient is going into the shock. So the patient will present with tachycardia. As I told you, the heart is trying to maintain the blood pressure. As a result, it starts beating faster. There will be tachycardia, and the skin perfusion is reduced. Okay, it will cause vasoconstriction of blood vessels, and it is causing the reduced blood supply to the extremities and the skin. Cold extremities will be there, delayed capillary refilling, weak pulse, and lethargy, restlessness will be seen. This is a sign of reduced brain perfusion. When there is a reduced brain perfusion, then what happens? There is lethargy and restlessness. Pulse pressure less than 20 mmHg with the increased diastolic pressure, which is, you can see that the patient will have 100 by 80. The systolic blood pressure is 100, whereas the diastolic blood pressure is less than 20. I'm not able to remove this, I don't know. Yeah. Hmm. So the pulse pressure, the less than 20 mmHg with increased diastolic pressure. You can see 100 is the systolic pressure, and the diastolic pressure is just less than 20, which is 80 mmHg. And the hypotension by age, you can see the systolic pressure less than 80 mmHg for those less than 5 years, or 90 mmHg for older children and adults. You can see hypotension, that is reduced BP will be there. Then compensatory tachycardia can occur, or later on the once the blood supply completely reduces, then there will be decrease in the pulse, and also you can see the decrease in the perfusion. Brain perfusion reduces, the patient can present with lethargy, restlessness. All of this can be seen. Weak pulse, restlessness, brain perfusion also reduces. Next, we will move further to the complications. The complications will include the dengue shock syndrome, acalculous cholecystitis, acalculous cholecystitis. You can see the cholecystitis, there is inflammation of the gallbladder, acalculous, without any calculus formation, without any stones. Okay, without any stones, there is an inflammation of the gallbladder. And why the inflammation of the gallbladder occurs, we know that these viruses will go and affect the gallbladder, causing the gallbladder's edema. And then there will be acute pancreatitis, inflammation of the pancreas. The cytokine release, as we discussed earlier in the pathogenesis, the virus will go and affect the immune cells, and these immune cells will get activated. The virus is affecting the immune cells. Activation is releasing to the is causing the release of cytokines. These cytokines will go and cause the inflammation of the brain. They will cause the inflammation of the gallbladder. In the brain, it will cause meningitis at times, and it will cause the lethargy, irritation, restlessness. Irritation will be there, restlessness. And then we'll see in the gallbladder, it causes the inflammation of the gallbladder. It causes the stretching of the Glisson's capsule. There is so much edema occurring, leading to ascites, and the stretching of the Glisson's capsule causing the right costal margin tenderness, and also the edema accumulation into the abdominal cavity, leading to ascites. And there is causing an inflammation of the pancreas, causing pancreatitis. Cerebral hemorrhage can occur, cerebral edema, cranial nerve palsies, hepatitis, encephalitis, and it also causes myocarditis. How myocarditis? So we see that the virus also affects the heart muscles. It will affect the muscles of the heart. It affects the heart muscles and also the conduction system of the heart. It causes the myocarditis. Conduction system is also affected. It is causing the myocarditis, and it slows down the electric conduction of the heart, leading to bradycardia. Okay. Then later on, when it affects the heart conduction system, electrical activity of the heart resulting in the bradycardia, and it also causes the severe bleeding. The virus will damage the endothelium, causing the plasma leakage, decrease in the platelet count. All of this will also cause the severe bleeding. Now we'll see what are the laboratory diagnosis. Yeah, the laboratory diagnosis: the virus isolation taken during the first 6 days of illness. Then you can also perform the viral nucleic acid detection test. The dengue viral genome will consist the RNA. It can be detected by RT-PCR assay. Okay, the viral nucleic acid test can be done. And then we have immunological. Then we have the immunological. Okay, yeah, here. Sorry, we were here. Complications were done. We were in the laboratory diagnosis, right? Yes, from here we will see that it will lead to immunological responses. In the immunological responses and the serological test, we will have, oh my god, from here there is some issues with this. Yeah, we are going to take it from this slide, from the laboratory investigations. Yeah. The immunological responses and serological tests, we can do the heme agglutination inhibition assay. The indirect IgG ELISA test can be done. You can also check the IgG IgM ratio, IgM IgG ratio, and we have the neutralization test. We have the viral antigen detection test, rapid diagnostic test, and analyzing of hematological parameters like platelet count, hematocrit monitored. All of these are the laboratory diagnosis to dengue. What are those? Virus isolation in the first week, virus nucleic acid detection test, heme agglutination inhibition assay, heme agglutination inhibition assay, and we have indirect IgG ELISA. We have indirect IgG ELISA. You can analyze the hematological parameters, like analyze the platelet count, which will be decreased, and hematocrit monitored, hematocrit values will be increased. And we have rapid diagnostic test, viral antigen detecting test, neutralization test, IgG IgM ratio, etc. Next we will move further, the dengue diagnostic and sample characteristic. So, the virus detection and its components. The acute serum in the first to 5 days of the fever, and the necropsy tissues. The diagnostic method for the acute serum, we are going to detect the virus. What is the method we are using? Virus isolation, nucleic acid detection, antigen detection. The virus isolation, the methodology is the mosquito or mosquito cell culture inoculation will be done, and the time to show the results will be 1 week or more. Or the RT-PCR test or the real-time RT-PCR is done, and the result timing will be 1 to 2 days. And NS1 and antigen rapid test, it will be seen within minutes. Okay, NS1 antigen rapid test, NS1 antigen ELISA within 1 day. And then we have serological responses. The paired sera, that is the acute serum from 1 to 5 days, and also the second serum 15 to 21 days after. Then we will see the antibodies detection. The diagnostic method is IgM IgG seroconversion. The methodology used is ELISA, heme immunoglobulin agglutination test. Okay, heme agglutination inhibition assay. HIA stands for HIA, heme agglutination, heme agglutination inhibition assay, and we have the neutralization test, which will take minimum 7 days, and the ELISA and heme agglutination inhibition assay is done within, shows results in 1 to 2 days. And the serum after day 5 of fever, the IgM detection is the diagnostic method. IgG detection, the methodologies used are ELISA, rapid test, IgG ELISA, or heme agglutination inhibition assay, and this can be obtained, ELISA 1 to 2 days. You can see wherever ELISA is there, it takes 1 to 2 days. Rapid test can be done within minutes, and IgG ELISA and HIA takes 1 to 2 days. Is it clear? So we see that, yeah, the viral antigen detection. The viral antigen detection, what do? We will do the antigen, the virus, dengue virus antigens detection is done. How can we detect the viral antigen detection? Is done with the help of ELISA. Okay, ELISA and the dot blot assays are also directed against the antigens membrane or the envelope, and it is directed against the non-structural protein 1, and they can be detected in the patients with secondary ns1 antigen, or it is directed against the envelope or the membrane of the antigen. It is directed against the envelope or membrane of this antigen, and this can be detected in both primary and secondary dengue infection, and it takes up to 6 days after the onset of infection. Okay, the commercial kits for the detection of ns1 antigens are now available. However, these kits do not differentiate between the serotypes. We also have the kits which are available to detect this antigen, but they do not differentiate between which virus infection is there. They do not tell us which actual dengue virus serotype is affecting, but it can provide an early diagnostic marker, but it gives results in very quick 1 to 2 days. So it becomes a rapid diagnostic marker for clinical management. Okay, and then we have rapid diagnostic test. One was ELISA, and next we will see the rapid diagnostic test. Rapid diagnostic tests. So we have this commercial rapid format serological test kits for antigen dengue, IgM, IgG antibodies. They have become available in the past few years. They will produce results within minutes. Okay, within few minutes they will detect the anti-dengue IgM and IgG antibodies. Rapid diagnostic test. They will show the anti-dengue IgM and IgG antibodies they will detect, and they are producing results within 15 minutes. They will show us the results. Now we have hematological parameters like platelet count, hematocrit. They are also very important in diagnosing an infection. Okay, then what are the two things we saw? Viral antigen detection, rapid diagnostic test, and the laboratory values, the hematocrit parameters. In the lab values, the hematocrit parameters. The hematocrit parameters will include the platelet count and the hematocrit values. They are also becoming a diagnostic of the dengue infection. Is it clear? Next, we will move further to the management. Encourage the intake of ORS, fruit juices, other fluids which are containing the electrolytes and sugars, because we quickly want to restore the plasma volume, right? So increase in the oral rehydration solution, fruit juices, other fluids which are containing sugar, electrolytes is encouraged. Paracetamol can be given for high fever, and then we can see that most importantly, The interval of paracetamol dosing should not be less than 6 hours. Tepid sponging can be encouraged if the patient still has fever in between those 6 hours. And do not give aspirin, ibuprofen, NSAIDs, as these drugs will aggravate the gastritis and can lead to bleeding. Is it clear? When the patient is having high fever and he also complains of lots of body pain, bone pain, muscle pain, avoid NSAIDs, and also avoid aspirin. Okay, aspirin, which is acetyl salicylic acid, aspirin, which is acetyl salicylic acid, and other ibuprofen and other non anti-inflammatory drugs, ibuprofen and the other non-steroidal anti-inflammatory drugs, because these drugs, what do? They will aggravate the bleeding, causing the GI inflammation. Gastritis can occur, they will cause bleeding. Then we also have to instruct the caregivers that if the patient is should be immediately brought to the hospital if the patient is showing any of the following occurrences. If he is not showing a clinical improvement, if there is a deterioration of the patient, if there is severe abdominal pain, if the patient has persistent vomiting, so if the patient is going into shock, that is, if the BP drops, severe abdominal pain is seen, clammy extremities are there, very cold extremities, abdominal pain, persistent vomiting, lethargy, if the patient becomes loosey, irritable, restlessness, bleeding is seen, that is, black stools can be seen, coffee ground vomiting occurs, not passing urine for more than 4 to 6 hours, so these patients should be immediately brought to the hospital. The patients who are sent home should be monitored daily by the healthcare providers for the temperature patterns, the volume of the fluid intake, the urine output has to be monitored, and the warning signs of plasma leakage, bleeding, hematocrit, blood cell values, platelet counts have to be checked on. And the rise in the hemo concentration indicates that IV fluid therapy is needed. So the hemo concentration shows that there is a decrease in the plasma volume, so the IV fluid has to be administered. If the patient has already received about 1000 ml of IV fluid, it should now change to colloidal solution, preferably dextran 40 has to be given. Okay, now when the IV fluids are given enough, then we are going to switch it to colloids like dextran. Next we have the clinical management. Now first we will grade the severity of the dengue infection. We are aware of all this. We will do a quick revision. We'll see if there is dengue fever, patient will have fever with two or more of the following. Along with fever, there can be headache, retroorbital pain, myalgia, arthralgia, rashes, hemorrhagic manifestations, no evidence of plasma leakage. And the lab findings, the patient will have leukopenia, thrombocytopenia, and raise in the platelet hematocrit. Next we'll have the WBC will be less than 5000 cells per cubic mm, and platelet will be less than 1,50,000. Less than 5000, normal values is 4000 to 11,000. And it will be less than 5000 cells per cubic mm, and the thrombocytopenia, the platelet count will be less than 1,50,000. Now we'll see the dengue hemorrhagic fever. In the dengue hemorrhagic fever 1, above criteria for dengue fever, along with this, the hemorrhagic manifestations will be positive, like a positive tourniquet test, and there will be slight evidence of plasma leakage. Thrombocytopenia, platelet count now has come down to 1 lakh. Then you have to understand the patient is in hemorrhagic fever. Hematocrit rise by 20%. Here hematocrit rises by 5 to 10%. Hematocrit rises by 5 to 10%. Here hematocrit rises by 20%. Then we'll see dengue hemorrhagic fever. In second stage, there will be above signs and symptoms plus evidences of spontaneous bleeding in the skin and other organs also. There will be bleeding. The patient will have epistaxis, nose bleeding, bleeding from gums, black tarry stools, melena, and also abdominal pain. Platelet count will become less than 1 lakh. Hematocrit rises 20% plus more. Then dengue hemorrhagic fever in third stage, the above signs plus circulating failure. Slowly the shock symptoms set in, weak, rapid pulse, pulse pressure less than 20 mm Hg. As I said you earlier, 100 by 80. If the systolic pressure is 100, the diastolic pressure will be just 20, less than 20 mm Hg. Hypotension with the presence of cold clammy skin, restlessness. Here platelet count will be less than 1 lakh cubic mm. Hematocrit raises more than 20%. Then we have dengue hemorrhagic fever 4, signs as grade 3. All of this signs as grade 3 plus profound shock with undetectable blood pressure or pulse. You cannot record the blood pressure. The pulse is non-detectable. The BP is non-recordable. So the thrombocytopenia, platelet count will be less than 1 lakh mm, raises hematocrit more than 20%. Next, what are the control measures we can take? The mosquito control can be done. The vaccines like CYD, TDV is a prophylactic treatment. So we can see that the management includes the vaccination, and we have the CYD TDV. It is a single dose vaccine. Now we see that CYD TDV. Okay, and then we see that the vaccine, it is a prophylactic tetravalent vaccine. It is a live attenuated viral vaccine. This vaccine was developed by Sanofi Pasteur in December 2015. The vaccination schedule consists of 3 injections of 0.5 ml. Okay, this consists of 3 injection, this vaccine CT. Okay, YD DV, CYD, 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 TDV, CYD, TDV. CYD TDV vaccine consists of 3 injections, which is 0.5 ml administered at 6 months interval. The indication from the first license is for the prevention of dengue illness caused by the virus serotypes 1, 2, 3, and 4 in individuals who are aged 9 to 45 years and 9 to 60 years of age. Depending upon the license, living in dengue endemic areas, the lower limit of infection or the indication for the vaccine is 9 years of age. Is it clear? This virus has got a vaccine against it. This CYD TDV vaccine is a prophylactic vaccine. We are trying to prevent the dengue infection, and this vaccine is administered in the individuals who are aged between which year 9 to 60 years of age, and those who are living in the endemic areas, it is the lower limit of this vaccination administration is 9 years, and this vaccine is given at 6 months interval. 0.5 ml injection is given. 3 injections of 0.5 ml are administered at a 6 months interval. It is a single dose vial or multi dose. 5 doses vial are also available. It is a freeze dried product. It is reconstituted before injecting. The reconstitution can be it can be reconstituted with either a sterile solution of sodium chloride for the single dose preparation, or sterile sodium of 0.9% composition or 0.4% composition of sodium chloride can be used for its reconstitution, and subcutaneously the vaccine is being administered. Is it clear? Next, the vaccination is contraindicated in few people. So the individuals who are having a history of severe allergic reaction to the any component of dengue vaccine, they are contraindicated, and individuals who are having congenital or acquired immune deficiency that will impair the cell mediated immunity, they are also contraindicated. And individuals with a symptomatic HIV infection or asymptomatic HIV infection, when they are accompanied by evidence of impaired immune system, those who are having an impaired immune system, the impaired immune system, it can be a congenitally acquired immunity deficiency or impaired cell immunity, or those who are having HIV infection, those who are symptomatic HIV, asymptomatic HIV with the impaired immune system are contraindicated. And the pregnant women, breastfeeding women are having a contraindication to the vaccine. Is it clear? Yeah. Moving further, we have the global strategy for dengue prevention and control from launched in the year 2012 to 2020. Dengue is a global threat. Now we know that dengue is a global threat. It requires a global response. So it is involving all the possible partners. The global strategy promotes the coordination, collaboration among the multi-sectorial partners on integrated vector management approach and sustained control measures at all the levels. Okay, so what they're doing, since this dengue is a global threat. What is dengue? So we know that dengue is a global threat. Since dengue is a global threat, it requires global response. The global response involves the coordination, collaboration. We need to coordinate and collaborate with all the multi-sectorial partners from different sectors. Okay, it requires collaboration and coordination from multi-sectorial partners. And on the integrated vector management, what do we want to do? We want to perform the vector management and control measures at all the levels. So the goals include to reduce the mortality of dengue by at least 50% by the year 2020. Dengue mortality is the deaths which are caused by dengue. We want to reduce the dengue mortality by 50% by the year 2020, and we want to reduce the dengue morbidity, which is the diseases, by at least 25% by 2020, and to estimate the true burden of the disease by the year 2050. We want to actually determine what is the true burden which the dengue disease is causing. Thanks for watching. With this, we come to an end of the session, dengue infection or dengue syndrome. And then in the next session, we are going to discuss a very important topic, that is malaria. I hope you liked the session. It was quite lengthy, but it was totally informative. We got to understand dengue syndrome in detail. So if you like the video, do not forget to subscribe the channel, hit the like button, and also share it to your friends so they can benefit. Thank you.